Here is your stem. When you get ready, please let us know.
I'm ready.
All
I am
right.
ready.
Okay, so if you've read and understood, considering it communication skills station, please begin.
Hi, I'm Dr. Ali. I'm one of the surgical doctor here. May I confirm your name and age, please?
I am Michael. I am 55 years.
Nice to meet you, Mr. Mike. Today, I've been asked to talk to you about an investigation that we would like to arrange for you. Can you please tell me what do you know about it so far?
I met one doctor said to me he will do something called OGD. I don't know what's OGD.
Okay, actually, it's esophageogastroduodenoscopy and abbreviated as OGD. And we actually, in this procedure, insert a camera through your mouth into the mm, uh, food pipe down to the stomach and to the first part of your bowel to take a better look. And the camera can actually give us an image on the TV so that we have a better look at your food pipe, stomach, and the first part of your bowel. And during that procedure, we can actually dilate the narrow part of your food pipe, which we earlier did an investigation called barium swallow, and it showed a narrowing at the lower end of your food pipe. And
Good.
we can also take a part of the lining of this food pipe so that we can better determine the cause of your case.
Okay, Doctor Ali, is there any risk for this procedure? I am
Yes.
fearing from the risk because I am watching the YouTube every day, and they say there is a risk for a lot of things from this OGD.
Yes, every procedure has risks, and the possible risks are that you can have tooth damage while we insert the camera, or you can have a chest infection, or can have bleeding from the point where we take the sample from your food pipe. And in worst case scenario, there could be a cut through your food pipe, and that may need a
Yeah.
surgery here.
How can I know if you, because I am watching YouTube, they said if, the dangerous is cut my food pipe. How can I know that you is there a cutting in my food pipe or not?
There would be some symptoms that would have us more conscious about that if you are having that or not, and then we can go through few investigation to look for it. But not essentially all patients have these complications. There are very few number of patients who can have those complications, and the surgeons who perform these are all skilled surgeon and perform
Okay.
quite a number of these
Okay.
procedures.
Okay. Doctor Ali, in this case, I don't want to do this procedure. I am fearing from the risk, very risk, this procedure.
Uh, Well, I would
Yeah.
I would advise you to accept this investigation to undergo because it is crucial for the determination of the cause of what you are going through.
Okay. Look, my saliva is now coming out my mouth now. I am more talking to you. It is a very frustrating problem with me.
Yes,
Okay,
please.
I
I would like to give you this tissue so you can wipe it
Okay,
off.
thank you, thank you, thank
And
you.
and
Okay,
actually, the probable cause of your excessive salivation is because the narrowing of your food pipe, which is causing the regular secretions to not go down but
okay,
come out.
Doctor Ahmed, I have some. Why I am keeping salivate like this, and the saliva is out my mouth.
Yes, because as I just said that there is narrowing of your food pipe and your regular salivary secretions
Is
are
it
not
cancer?
going.
Is it cancer?
It is too early to say because we would have to wait for the results of this investigation, and it may take 14 weeks. And if we find that report to be suspicious of cancer, we will have to go for a few
14
other
days,
investigations
2 weeks,
Is it 14 weeks?
14 days.
for 2 weeks. For 2 weeks, yes.
2 weeks. Okay. When will be able to go home?
Uh, this procedure after 2 to 4 hours, when your sedation resolves, you can go home, but for 24 hours you won't be able to drive, so you got to have to bring somebody who can drive you.
Okay. Okay. Thank you.
Will I be
Okay.
awake for the procedure, doctor? I'm afraid I
No,
don't want to stay awake.
no, you won't be awake. You would be sedated with the medication and you would be drowsy.
Okay. Please tell
uh,
me, yes, what should I eat or not to eat during this procedure?
Well, before this, 4 hours before this procedure, you will have to stop eating or drinking.
And when can I resume my eating?
After 4 hours, you can resume eating.
Okay.
Okay, to summarize what we have been through, that we would like to arrange an investigation for you, which is to determine the cause of your salivation and the narrowing of your food pipe. And I have told you about the risks and the possible complications, and also about the results that when we receive, we would inform you through contacting you.
Okay.
I hope everything is clear.
Yes,
Yeah,
doctor.
And
it's
If I
clear.
don't
Thank you.
want general anesthesia, is there any other way I can be managed for this procedure?
no, in this procedure, we won't give you general anesthesia. It would be a light sedation with a drug called midazolam for OGD.
Okay. All right. I don't have anyone to bring with me, so I'll definitely not drive, but I'll go back home on my train. That shouldn't be a problem, right?
Yeah, that won't be a problem at all.
There is a problem, doctor.
That's
Okay, there is a problem. They don't allow because if patient after procedure becomes syncope all of a sudden and drops or falls in the local transport, so who would take the risk? So if examiner asks you this question, you'll say no, you'll rather help or advise the nurse to arrange taxi for the patient, rather ride a
oh,
taxi than to travel by public transport, either bus or train. No. Okay.
Or
okay.
or
Thank
or, or admit him, right?
No need
Admission.
to no need to admit because and it's not general anesthesia, it's a local spray that you do, you know,
Mhm.
local
oh,
anesthesia spray that one has to do it.
okay. Thank
And
you.
if patient is really conscious and does not want to go through this one, then patient can have this procedure under under general anesthesia.
Okay. Thank you, ma'am.
Thank you.
So arrange transportation or taxi. That
Taxi.
is feasible.
Taxi. If patient does not have anyone to take him home, then you can help him with the taxi.